is Jessica Trevora. I'm a Texas State nurse practitioner student working with Dr. Smith today. With your permission, I will be performing a health history interview. Is that okay?
Mm-hmm.
Okay. What concerns bring you to the office today?
Oh, over the past 3 months, I've been really tired feeling and gained some weight.
How much weight do you think you've gained over what period of time?
I've probably gained 15 pounds in the last 3 months.
Okay, so pretty significant. Has anything changed in your lifestyle?
No?
No? Okay. Do you work out?
I do. I do Zumba and I do weightlifting probably about 30 minutes, and I do it every other day.
Okay. What about your eating habits? Have you tried any diets? Is there anything that's working or not working?
Yes, I've tried diets. I've tried the MyFit Foods and Ideal Protein diets. No success.
Okay. Okay. Well, let's go ahead. If it's okay, I'd like to go over your past and present medical history and see if we can get some more information. Okay. Have you ever had any surgeries?
Yes, I had a breast augmentation in 2013, and I had a tonsillectomy as a kid.
Okay. Have you ever been pregnant before?
Yes. I have one baby.
Okay.
Mm-hmm.
Did you have any problems with that delivery?
No.
No problems. Okay. Any history of psychiatric disorders, feeling depressed, anxious, anything like that?
No.
No. Okay. Do you have any allergies?
I do have a latex allergy. It causes me to break out in hives.
Okay. And then what about vaccines? Are you up to date on your vaccinations?
Yes, I am.
Okay. And I saw on your patient paperwork that your last pap smear was in 2014 and that was normal, but you don't remember when the last time you got blood work was.
No, I think it was probably before my breast augmentation in 2013, but I don't know. I need the results. I'm not sure.
Okay. Okay, and then what do you do for a living?
I'm a nurse.
You're a nurse. Okay, so you're on your feet a lot.
Yeah, very active.
Okay. What about your caffeine intake?
I drink probably 1 to 2 cups of coffee a day. I don't drink any sodas or anything, but I do have tea for dinner.
Okay. All right. Are you married?
Yes, I am. It's been about 4 years now.
Okay. And then do you have any religious preferences?
Yes, I'm Christian.
Okay. And I take it you and your husband are sexually active?
Yes.
Okay. How many partners have you had in your lifetime?
My lifetime, probably 5 to 10.
Okay. Any history of sexually transmitted diseases?
No, never.
No. Okay. Are you currently using anything for contraception?
Yes, Loestrin 24.
Okay. What about alcohol use? Do you drink alcohol?
On occasion, I'll drink wine with dinner, and then occasionally, socially, I'll go out with friends on the weekend and have probably 2 to 3 drinks.
Okay. What about smoking? Have you ever been a smoker?
I'm a former smoker. I stopped about 2009, and I did it for 3 years just during college.
Okay, great. Any recreational or prescription drug use?
No, never.
Okay. And then besides your Loestrin 24, are you taking any other medication?
No.
Okay, great. Let's go ahead and move on to your family history.
Okay.
So, starting with your mother, is your mother still living? Does she have any health problems?
Yes, she has hypothyroidism.
Hypothyroid. Okay, what about your father?
He has high cholesterol.
Okay.
But he's living.
He's living, okay.
Okay.
And what about your maternal grandparents?
My mom's mom and mom's dad both have hypertension. They're both living.
Okay. What about your dad's parents?
My dad's mom, she's living. She has type 2 diabetes. And then my dad's dad, he died, he was I think about 82. He died of lung cancer.
Okay. What about, do you have any brothers or sisters?
I have a sister. She's 32, and she also has hypothyroidism.
Okay. Let's go ahead and move on to see kind of how you're feeling overall. Do a quick review. So you're feeling fatigued, and you've had some significant weight gain. Any fevers, loss of appetite, chills, weakness?
No.
Okay. Do you wear glasses or contacts?
No.
Any changes in your vision? Any redness, tearing, spots in your eyes? When was your last dental exam? Sorry, your last eye exam.
Well, they're actually both in 2013.
2013. Okay.
Mhm.
Any headache, head injuries, hearing problems, sore throat, dry mouth, any problems with your head, ears, nose, throat?
Mm-mm.
Okay.
No.
Any lightheadedness or vertigo?
No.
Okay. And your last dental exam was in 2013.
Yes.
What about your breast? Any lumps, swelling, discharge? No.
Mm-mm.
Do you do self breast exams?
Yes.
Okay. And when was your last breast exam by provider?
It was in 2014.
2014. Okay.
Mhm.
Any heart problems, chest pain, palpitations? Feel like your heart's beating really fast ever?
No.
Okay. What about shortness of breath, difficulty breathing, productive cough?
Mm-mm.
No. Okay. What about moving on to gastrointestinal? Any constipation, nausea, vomiting, diarrhea?
I have been constipated same amount of time, probably 3 months.
Okay. Any problems voiding, pain when you void, blood in your urine, lower back pain,
Mm-mm.
anything like that?
No.
Okay. And do you have pretty regular periods?
I do. Mhm.
Okay. When was your last period?
It was January 5th.
Okay. Any abnormal bleeding, painful bleeding, bleeding after sex?
No.
Any vaginal discharge, odor, itching?
Mm-mm.
Okay. Any skin lesions, rashes, bumps, moles, anything that you've noticed that's changed? No, in that department, no. What about muscle weakness, muscle aches, joint pain, and back pain?
No, I have been feeling a little bit weak though.
Okay, a little weak.
Mm-hmm.
Any problems with sweating, weakness, temperature intolerance, hair thinning?
My hair has been getting really thin.
It has been,
Mhm.
okay. Just here recently as well?
Yeah.
Okay. Any problems passing out, seizure disorders, history of seizures, weakness, tingling, numbness, difficulty speaking, loss of balance or tremors? Okay. And you said, no depression, anger, sleep disturbances, hallucinations, delusions, anything like that?
No.
Okay.
Mhm.
How long do you think you sleep at night?
I sleep all night.
All night? Okay. Probably about 8 hours?
Yes.
Okay.
Yeah, probably 8 hours.
Any easy bruising, any lumps that are feeling enlarged, any spots? No.
Mm-mm.
All right, well, let's go ahead and move on to your physical exam.